In this video, I will tell you how to sterilize your expensive endoscopy instruments, your scope, your drill, etc., and increase their life. So there are two kind of devices which are available to us for packing the instruments before sending it for sterilization. One is this kind of a box in which all the instruments are usually put in one line, and this entire tray is then sent it for autoclave. And the other is this peel pack. So I'll tell you the difference between the two and where and why I use a tray and where I use a peel pack. So the instruments in the tray, they are all put in one line, which makes it convenient to send it as a whole, like a set, for autoclaving. One drawback of this approach is that all the instruments get sterilized in the autoclave, and all of them are exposed to the autoclaving agent, or that is steam in this case, again and again and again. But what we find is that there are usually 3 or 4 or 5 instruments which we are commonly used during the surgery, but the entire set gets autoclaved and it gets exposed to heat of sterilization, which causes expansion and contraction in the metal, and over a period of time it weakens the metal, and this may reduce the lifespan of your instruments. Like, share and subscribe for more medical insights. If you have any questions or topics you want us to cover, comment below. We'll be happy to create a video for you. This is Dr. Varun Agarwal, specialist in advanced robotics and endoscopic spine surgery. So, to avoid sterilizing the entire thing and opening it again and again, so the thing what I realized was that during the surgery I was using only 4 or 5 instruments, but the entire set was getting autoclaved, and all the instruments in the set are then exposed to the heat of the steam, and this was causing wear and tear of these instruments. So now we have started using something called a peel pack. So this is a peel pack, and if you come close, you can see that this peel pack can not only be used for ETO and plasma, but it can also be used for autoclaving. So this is how we peel pack the instruments. You can see the instrument is in a peel pack, and if you notice, here on the side is written steam, and there is a marker for EO or ETO, ethylene oxide sterilization. Similarly, this is one for plasma and the marker for ETO. So now this peel pack can be used both in an autoclave or an ETO, and this peel pack can be used in a plasma and a ETO machine. The advantage of this approach is that the instruments are individually packed, and whatever the instruments which we need are only opened, the rest do not need to be sterilized again and again. The lifespan of an instrument which has been peeled pack in an ETO, if we do not disturb this peel pack, it will be remaining sterile for 1.5 to 2 years. Same is for plasma. If the peel pack is not open, it is sterile for 1.5 to 2 years, and for the steam, the life is around 1 year to 1.5 years. So this way we can avoid repeated use of sterilizing the instruments which we are not using. The instruments are always available to us in a sterile manner whenever we want, and they can be easily opened by the staff, but unnecessarily their sterilization is avoided, and which prevents the wear and tear of the equipment and also saves the repeated cost of unnecessary sterilization. So what are the instruments which I use for steam sterilization, and what are the instruments which I use for ETO or plasma, depending upon what resources available in your hospital. So all the metallic instruments which do not have any plastic parts or non-autoclavable parts I use them in the steam sterilizer in a peel pack, and all those instruments which have a plastic which can get melted in the high heat of the steam, I use it in a ETO or a plasma. All these instruments are double packed, so that when the staff opens it up in a sterile manner like this, they can hand it over to the scrub assistant in a sterile manner like this, which he takes out, and then he can open it on the trolley. So this way we are doubly sure that the instruments are not accidentally made unsterile, and we can use them during the surgery. So we use this policy of We use this policy of double peel pack for plastic or wires or instruments which are more sensitive, like an endoscope. We give them for ETO or plasma, and for instruments which are autoclave friendly, which are pure steel, which do not get the parts of these instruments do not get spoiled on autoclave. We again peel pack them and put them in an autoclave, so that we don't, if we are not using the instrument during the surgery, it doesn't get opened and we don't repeatedly unnecessarily end up autoclaving them.